16,000 reported cases in 75 different countries and territories so far. Monkeypox is the latest virus to be called a global health emergency of international concern by the World Health Organization, or WHO. This is the highest alert the organization can issue. Since this May, cases started emerging in countries where the disease is not endemic, sparking concerns over why the virus has been found in widely disparate geographical locations. How severe is the situation? Why are there different opinions on the WHO's classification, and how concerned should we be? I'm pleased to be joined from Nanjing, East China, by Professor Zhiwei from the Center for Public Health Research of the Medical School at Nanjing University, and from Washington, D.C. by Dr. Eric Ding, Chief of the COVID Task Force at the World Health Network. Gentlemen, welcome to The Point. So, Professor Wu, let me go to you first. Here's what we know for now. As of July the 22nd, over 16,000 cases in 75 countries and territories, and 5 people have died in Africa. That's according to the World Health Organization. And the virus is currently primarily spreading in Europe, and 99% of reported cases are among males. So there is also a lot that we don't know. What is your assessment of the current situation and the WHO's decision to label monkeypox a public health emergency of international concern?
Well, the monkeypox was identified in 1958, and the first case was identified in human in 1970. So this virus has been mainly endemic in some African countries, mostly in the Central and West African countries close to rainforest areas. So it rarely spread out of those regions. This time is quite different from all the previous small outbreaks that the virus landed in the area in various different countries, which are not traditionally found the monkeypox. So the other thing actually is quite dramatic, is that the number of infected cases shoots up very quickly. Because in all the previous infections, usually the case numbers are pretty small and usually goes away pretty fast. Very rarely is that the virus spreading in such a large area and a large population.
Yeah.
So that I think that's a very critical difference from all the previous cases.
Yeah. Eric, what is your understanding of the WHO's head Director General's decision to call this a international public health event of international concern, and how rare is it for two viruses or two diseases to be spreading at the same time around the world?
Yeah, I think it was a very good decision to declare the public health emergency. Although I would say it's a month much later than they should have. They first convened and tried to decide whether to declare in June. They did not. My group had advocated they had to urgently declare back in June. But late is better than never, and I'm glad Dr. Tedros, the Director General of WHO, overruled his advisors who were kind of stalemated, and he pushed forward with the declaration. And to put into perspective how incredible this outbreak is, over 40 years, we've only tracked about 2,000 monkeypox cases worldwide. In just 2 months, we've tracked almost 20,000. Again, 2,000 in 30 years, 20,000 in just around 2 months. And this is an incredibly different virus than what was previously circulating. The new genomic studies of its DNA shows it is highly, highly mutated than what used to be around. And so we should expect that it transmits in a much more dangerous way to humans.
Okay,
and this is why the emergency is definitely needed.
Right, let me come to that in just a moment, but you did mention the division among advisors. Basically, the WHO Emergency Committee did not reach a consensus on the decision. Professor Wu, as we know that there are members, actually it's reported that more members on the committee were reportedly against the decision to call it a public health emergency of international concern than those who supported. And their opinion is reported that the disease has caused very few deaths so far, as I said, 5 alive and is not spreading among the general population, mostly concentrated on a specific group. And there were fears that calling this disease a fake, which is the public health emergency of international concern, could lead to stigmatization or further stigmatization of men who have sex with men, the gay group, and so on and so forth. So, Professor Wu, are these fears legitimate? How do you look at the division among the opinions among the experts?
Well, if you look at the monkeypox, usually is quite self-limiting in adults, and severe cases and death usually happen in small children. And over the previous small-scale outbreaks, you basically you don't need to have a medical intervention. People, of course, disease causes very uncomfortable feeling, rash and itchiness, and also, a little bit fever. But usually it's not life-threatening. I think that's one of the reasons why the WHO's panel's opinion are divided on this issue. But the difference this time is that seem to be there is a certain kind of demographic profile, which is quite different from the previous outbreaks. It's mostly concentrated in gay population, men who have sex with men. So apparently there is something different. And the other thing is that from the epidemiological point of view, the spreading is a lot fast, as just Dr. Ding mentioned, that the genomic sequence that shows that there are a lot of mutations, which may facilitate its fast transmission. So I think from those information, it is a public health issue, but whether it's need to be international concern, I mean, of course, this is something we need to pay attention. But because of the initial population is mainly in the men who have sex with men, and that actually, if you declare this disease as an international concern, then emergency, then it could lead to certain kind of stigmatization. If this issue is stigmatized, then that would prevent people to report and get diagnostics. So that actually would hinder prevention and intervention approach.
But the outbreak, Eric, the outbreak has mainly, as I said, the cases mostly happen to men, and actually the numbers show 98% of the cases have been men, gay, sexual, or bisexual people, or men who have sex with men. But can anybody get it? This is the first question. And secondly, what explains the fact that the virus mutated so dramatically over the recent years that it become so much more virulent and spreading so fast?
Yeah, these are really good questions. I would point out that even though officially the numbers look like 98% are men with sex with men, that's very misleading. Well, that's based on surveillance bias. We're focusing our tests most aggressively in gay LGBT populations. And so if you focus your tests in that population and say in many countries testing is very limited, if you only test those groups aggressively, again, naturally you're going to find that. But I want to point out HIV used to be thought as a gay disease. It is not. It was heterosexual, and many people got it. And once HIV became global, children got it, and people of all walks of life got it. So this stigmatization is dangerous, and also it's very biased if you just focus right now because of limited early testing. And there's a lot of heterosexual cases. There's 72 cases in children already, 23 of which are very young children. So right now anybody can potentially get it. Obviously, certain groups are still higher risk, but as the pandemic expands exponentially, as it's continued to exponentially grow, the spillover to high risk children and immunocompromised people and pregnant women is very, very high. And again, and unlike COVID, which affected elderly the most, with monkeypox, the most high-risk groups are children under the age of 8, women, and immunocompromised. So we should not just allow this virus to spread, because ultimately it will reach the pregnant women and children, and that's who we're trying to protect by right now stopping the virus. And why did it evolve so much? Well, I think it's first of all, previously we had lots of smallpox vaccine immunity, but as people, fewer people are vaccinated, it has more room to grow, and the encroachment of people on animals, on the forests, basically has more human to animal contact as populations continue to grow, and this creates more spillover effects. And again, just bad luck with mutations will allow the virus to adapt to humans and quickly spiral out of control. So this is similar to what happened with the SARS coronavirus, as we know. So we have to be vigilant on this. Again, stopping transmission now, early, will protect children later on who are the extra vulnerable.
Okay. Professor Wu, Chinese epidemiologist Wu Zhunyou from the Chinese CDC said on Monday that the virus will not cause a mass infection in China, although there are 2 cases on Taiwan. He says it's only a matter of time for more cases to be spotted in other parts of China, although he said it will not spread widely. Do you agree with such assessment, given what Eric just said now?
Based on the historical transmission pattern, monkeypox will not cause large outbreaks. Based on this point, I agree with him. But we need to be very careful with the new wave of the monkeypox spreading, because as Eric just mentioned, that the virus mutated, whether that would affect its transmission efficiency, we don't know yet. But this is something actually we have to be highly alert, because we don't want, in the middle of the COVID-19, we have another outbreaks to deal with. So that's why the WHO declared this as an emergency issue. I think, we have to be extremely careful and understand how the monkeypox was transmitted. It is transmitted mostly through the contact and the body fluids from infected individuals and open physical wounds. Those are the way we know that the traditional transmission. The new transmission pattern seem to indicate that this virus may be transmitted through sexual routes as well. So this is something actually, I think, for public health experts to keep a close eye on it.
All right, we're going to keep a close watch on the situation. Many thanks to Eric Ding, Chief of the COVID Task Force at the World Health Network, and Professor Zhiwei of the Center for Public Health Research of the Medical School at Nanjing University.